Hello, everyone. Welcome to our spotlight program today on uh, Berks Encore. Hopefully you find it interesting, important program for the residents of Berks County. I'm Dave Myers. I am the director of the Berks Alliance. Berks Alliance has been hosting these sessions for about 2 years. Um, as a way of trying to introduce the community to important issues and organizations within our community that show value and we think people would benefit from learning about. Um, I'm going to ask you to leave your camera on so we can see that we're dealing with live people. We have a relatively small crowd today, so it's going to be even more important, but mute your microphones so while the presentation is going on. We ask you to use the chat function at the bottom of the screen to submit comments and questions. We'll get to those after the formal presentation. We try to have a hard stop at 1 o'clock. If we get done with everything before then, that's fine. That'll get everybody back to doing whatever they're doing for the rest of the day. But on behalf of the Berks Alliance investors, I want to thank you for joining us today. And with that, I'm going to turn it over to Luann Oatman, who's going to the presentation. Luann, thank you.
Sure. Hello, everybody. Thank you very much for being here. We're going to talk about one of my most favorite subjects in the whole world, and that's Berks Encore. I love who we are. I love what we do, and you'll find that as I age, or I'm finding that as I age, I love even more who we are and what we do. So I'll go through who we are, what we do, show you some slides. I don't read you the slides. Use the chat function. If I talk too fast, just unmute yourself and say you're talking too fast, because I tend to just zip, zip, zip along. And then at the end, happy to answer any questions if I'm able to and can help. So here we go. Can you see my screen? Okay, great, wonderful. So we are Berks Encore. We changed our name to Berks Encore back in about 2008. We started out as the Berks County Senior Citizens Council, and that sounded really governmental and kind of blah. So when I came in about 18 years ago, I was like, yeah, we got to change our name. So we did some research. We hired a marketing company, and I don't know if you remember back when the commercials were going on. Remember when Disney was running those commercials where it was like, people my age going back to Disney and, having it was called like the encore of your life. So it was the trend. We liked it. We thought, let's set a trend. Yay for us. Changed our name to Berks Encore. And at that time, our tagline was applauding life after 50. We've changed our tagline within the last year to be yourself. We like it that way. We want to be seen as inclusive. We want to be seen as for anyone who is seeking assistance with aging. And given that we're so widespread between the city of Reading and all of the outlying communities, we just want everybody to be who they are and feel accepted and be happy. All right, now I can't, there we go. All right, it was a little late. So there's our mission statement and our vision statement. And basically what we're about is we want to engage the community and allow people to age well. But we understand that people want to define for themselves what aging well means. It might mean one thing to me. It might mean it would have meant when my mom was alive, something different to her. So we understand that aging well can be pretty all-encompassing, and not all of us want to do things exactly the same way. Some of us want to retire at 62. Some of us, like me, have no plans to retire. So but I still want to be able to age well and help to be a part of defining what that is. We did go through a very intensive diversity, equity, and inclusion workshop time with our board and our staff. And we decided that it wasn't just about women and minorities. It isn't just about legislating behavior and hoping for change. And it's not affirmative action, because if it were, that would have worked way back when they did affirmative action the first time. So what we try to do is live out our mission and value all of the differences. And if you came to any one of our centers, if you've seen one Berks Encore Center, you have seen one Berks Encore Center, even though we have 6 of them, because we try to reflect the community that we are serving in each center. A lot of people ask about how we work and what's the difference between us and the Berks County Area Agency on Aging. We have a very strong public-private partnership, and we subcontract with them. So right now we have 4 contracts with the Berks County Area Agency on Aging. We also have another contract with the Human Service and Development Fund out of the county of Berks. So we're always looking for new ways and innovative ways that we can work together with the community. I'm a big believer in collective community impact, not replicating what already exists, and trying to figure out how we can work together. So we do the home delivered meal program. We're the primary provider of care management and home delivered meals to the homebound in the county of Berks. Boyertown Area Multi-Service also does this in the Boyertown community, but we are delivering meals out of Reading, Shillington, Wernersville, Fleetwood, Douglasville, and Strausstown. Every center, so you'll see underneath here where it says senior centers, every center exists as a hub for providing the home delivered meal program. So we provide care management, we operate the senior centers, everybody who comes to a senior center has an opportunity to have, the government calls it a congregate meal, I like to call it lunch. So they get to have lunch if they would like to have it. And then we do evidence-based health and wellness programming where we're looking at Stanford University and Harvard University and Johns Hopkins, where they're actually doing research and proving that you can do to age well in fall prevention, in balance improvement, in chronic disease self-management can actually help you to live a healthier and longer life. And then this is one of the things we're known for, but not exactly well known for, is what's now called PA Medi. At the federal level, it's called State Health Insurance Program, SHIP. Then Pennsylvania at one point used to call it a prize because we were keeping you apprised of the changes in Medicare. And then last year they decided to change it to the Pennsylvania Medicare Education and Decision Insight, PA Medi. What is it? It's Medicare counseling. So we have, I have one staff person and a host of volunteers who live, breathe, eat, sleep, and drink Medicare year round. And what happens right now, if you're seeing we were talking about a little earlier before everybody joined us, you're seeing all those commercials on television right now. You know, Joe Namath is out there telling you about, Medicare Advantage and some other Hollywood-y folks that would be recognizable to those of us in a certain age group, telling us how there's this Medicare Advantage program. We do counseling free. We do not affiliate with any health insurance provider. And when we help folks enroll, we enroll them directly in the national company. We don't go through any brokers or agents. And this can sometimes have a pretty big impact on somebody's life, some more than others, but I can tell you just out of personal experience with my mom, when I brought her in to see one of our counselors, my mother, who had a phenomenal retirement package with lifetime health insurance, was paying around $333 a month out of her pocket because she was insured to be insured to be insured to be insured. She'd never be able to use it all. Brought her in to see one of our counselors, and my mother went from $333 a month to about $100 a month. So it had a huge impact on her. And the interesting thing also, well, I find it interesting, the average senior in the state of Pennsylvania is around the age of 82. She's a widow, and she lives on an annual income of around $22,000 a year and does not qualify for any additional subsidized services. So every dollar you can keep in their pocket, rather than paying health insurance premiums and outrageous prescription drug premiums and copays. It definitely helps. So Area Agency on Aging subcontracts with us to provide those services. To give you a snapshot of what we're doing, this is our 2022 community impact statements. We delivered about 113,000, little over 113,000 meals. Those were home delivered meals to about 667 unique clients a week. Now, we had an opportunity in 2022 where you'll see here the Area Agency on Aging. When you see BC AAA, that's what I'm talking about, the Area Agency on Aging. They provided some funding to help harvest, and we were able to deliver 16,250 bags of fresh fruit last year and produce to seniors. And this is amazing stuff, because a lot of times with a Meals on Wheels meal, you might get apple slices, maybe you get a banana, you get a tangerine or something like that, or it's canned fruit in like its own juice or something. But when you can deliver fresh berries in the summer and kiwi and fresh asparagus or broccoli, something like that, it really does make a big impact and a big difference in the life of somebody who is homebound. They're no longer able to grocery shop for themselves. They have a medical qualification that precludes them from being able to not just grocery shop, but they can't stand at a counter or sink or stove for the 15-20 minutes it might take to prepare a meal, and we're talking a simple meal, and then maybe cannot stand, you know, the cleanup and the prep time and all those things. So for these folks, this is when they get fresh produce. It really is a wonderful, wonderful opportunity for them. And here, this is something we added a couple years ago. This is not standard in all home delivered meal programs, but what we call change of condition. The United Way provides funding for us to have a medical social worker or nurse sitting and monitoring our we call it our dashboard. So if you go out to deliver meals, you go out with a smart pad, tells you everything. You're going to get asked 5 questions. So you go to my home. It's like, was Luann home? Yes. So it means I got my meal. Then the next question would be, did you notice any of the following? And that could be things like, did I have slurred speech? Was I wearing the same clothing for 2 or 3 days in a row, or that my clothing were really soiled? Did you notice an odor that really needed addressing? Maybe it is unchanged adult wear, or it maybe trash needs to be taken out. Did I happen to tell you that I fell? Because a lot of times you'll walk to the door, you'll answer the door, and you'll see somebody with a gash or a bruise, and you ask them, what happened to you? Oh, I fell last night, but I'm fine. I don't need anybody to know. Well, you can just mark this off on this smart pad. When it comes back, everything uploads to the system, and then our staff will contact that senior and do some motivational interviewing. And what we find is a lot of times they're more willing to tell us about what's going on than they might be willing to tell their son or daughter, because they don't want to worry anybody. So we had a gentleman, for example, 2 years ago. He was not well. There was definitely something wrong, and the volunteer reported it. And when our nurse called him, it turned out he had been recently diagnosed as an insulin dependent diabetic. And you know how it is when you go to the doctor and they go through the instructions really, really quickly, and they say, and here's your printout, and you can read this, and this is going to tell you what to do. Well, he didn't understand how to dose himself. And he had basically used about 3 weeks worth of insulin in about a week and a half. So he almost had himself in an insulin-induced coma. So we were able to get in touch with his son, called his doctor, got him an emergency appointment, got him seen. He's actually doing so well now. He's coming to one of our senior centers. So we were able to get him off the home delivered meal program and over to a senior center where he can engage. And the average age that folks generally enter on a Meals on Wheels program, we're seeing the average age is about 75 plus. And the very interesting thing there is some of our volunteers are actually older than the folks they're delivering meals to. To give you an idea of how the funding is, Funding for our program runs about $656,000 a year. Berks County Area Agency on Aging funds 40% of that cost. United Way an additional 30%, and then we raise the remaining 30% that is needed. This is the cost for us to care manage and deliver and have a senior on the meal program for an entire year. That is less than what it costs for a day in an acute care hospital. But it does not include the cost of food. So here's another confusing thing. Berks Encore is the delivery vehicle and the care management vehicle. We do not provide the food. The food is a different contract managed by the Area Agency on Aging, and they have two vendors that they deal with. One vendor delivers to our Center City Reading office, where about 300 of the meals are packed and delivered from, and then there is another vendor who delivers to the other 5 centers. So it can be a little confusing, and it can be like, well, who actually does? I thought they did Meals on Wheels. I thought they did Meals on Wheels. You have a food vendor, and then we are the delivery and the care management vendor. Just some photos, because sometimes it's nice to see the people who are doing things. This is some photos of our Meals on Wheels volunteers. Here you've got some packing volunteers. This is our Wernersville Center. Here we have just a woman who's delivering to this couple. Gentleman, he's just the greatest guy in the world. You would love this guy. He's just a sweetheart. And here you see we have a lot of involvement for kids. In fact, we just dropped off a whole bunch of Christmas gift bags over to, I believe it's Holy Guardian Angels decorates the bag. And then there's another Catholic school. The name just went right out of my head. They help us stuff the bags, and then we deliver. So we just try to keep as much involvement as we can. Our wellness centers, there's a list of where they're all located. We had 1,200 unique patrons who participated in activities, so our centers are busy. We are almost back in all of our centers now to our pre-COVID numbers. Exercise is huge at our centers. Surprisingly, they do everything: Tai Chi, Qigong, yoga, sit and get fit. If there is an exercise class that we can bring an instructor in, our seniors want to participate in it. And then last year we served just a little over 29,000 noon meals to 706 unduplicated seniors across the county. Some of the activities, I got to tell you, this group in Strausstown, the watercolor class, they are amazing. And what is really incredible is none of these folks have ever done watercolor before. And we're doing all the classes through free over YouTube. It has been so much fun seeing what some of the seniors have been able to do, and the skills and things that they have learned about themselves. And this gentleman at our Mifflin Center, Blake, he is in so much demand. He's just this young guy who comes in, volunteers, teaches seniors how to use their smartphones and whatnot. And we honestly think there's a couple of them who they really do know what they're doing. They just like hanging out with Blake because he is just so cool with the older adults and just enjoys being with them so much. And I'd love to get that replicated at every one of our centers because it's just been a great time. Under health and wellness, we had 51 programs, 588 unique participants. 61% had never entered any of our senior centers before. So what I like about our health and wellness programs is it reaches an audience who do not want to come to a senior center, and that's okay. But we've done Eat Well, Be Well. We've done, what do you call it, where you go looking around. We go to Redner's and you do, it's a label finding thing and teaching folks how to read their labels. Stepping into history, that has become really huge. We've now been asked to start a senior biking club. Pickleball, huge, really huge. In fact, the Area Agency on Aging just paid to have a beautiful pickleball court installed up in Strausstown. And I got to tell you, they are competitive. I'm not sure I'd be able to keep up with some of these folks. And then we still do virtual exercise. We had started that, of course, during COVID. We do have some folks on our home delivered meal program who are unable to leave their homes, but want to do some exercise. So we kept the virtual classes for them. Everything, as I said, is evidence-based. Some of what we do, the chronic disease self-management classes have been great. There's chronic disease self-management, diabetes self-management, and chronic pain self-management. And what we're finding is these little niches are starting up of folks who really enjoy being together, and they just go from class to class to class. And then the next thing you know, they're feeling great. Now we've got them out with our stepping into history or our walking or our hiking clubs. So it's really, it's doing a lot for the socialization. It's doing an awful lot to improve health, and it's building connections, which is something that we didn't know that would be an outcome. And there we go. And then PA Medi. Last year, we counseled a little over 1,400 individuals, assisted them with reviewing their policies, enrolling. We have resolved billing issues, and we saved a total of $294,650 in 2022, which came out to an average of $202 a year per client. Took over 28 telephone calls. When I tell you we come in during open enrollment and we'll have like 100 voicemails, I'm not kidding you. And everyone gets called back. The goal is everyone has a call back within 24 to 48 hours. So our volunteers are very important. And everything we do is now in English and Spanish. We have, I'd say it's about 30% of our staff now, particularly here in the Reading Center, are bilingual. 3 of them, English is their second language. And they are working in Medicare. They are taking appointments. They are working our care management staff and our telephone staff in Meals on Wheels, because we're seeing our non-English speaking participants increase, and we want to be able to serve them just like we serve everybody else. We want everybody to receive their service in the language that they are most comfortable in. Every piece of printed material we put out now is available in English and in Spanish. And then we also work with rent and property tax rebates. And then during the summer months when the USDA makes the produce checks available, we assist in putting them out. And to let you see what the impact of volunteers really has on our agency, independent sector in 2022 valued a volunteer's time in Reading, Pennsylvania and Berks County at $29.95 an hour. If I had to pay for all of the hours, that would have cost my agency $1.6 million, and there's no way we would be able to do that. So when we talk about our volunteers and how much we value our volunteers, we really can't speak highly enough about them. And we have seen volunteers, we're in a shift right now because some of our volunteers are aging out, but it's been amazing to see some of the companies that are stepping up and saying, okay, we'll adopt a route, or could we do a collection, or, can we come in and paint your lower level, whatever. We're just very happy to have all of the volunteer support that we have. And then some of the other programs that are probably less known, we do grocery shopping for folks. We have 63 volunteers right now who are shopping for 105 seniors. And that in 2022 was about 2,700 grocery orders. So what happens is all of our shopping happens at Redner's. Seniors call our offices. We have somebody live who talks with them to take their grocery order because that connection is important. We tally up the grocery order, we fax it to or email it to the appropriate stores, let the volunteer know. Everything goes on a corporate card so the volunteer isn't having to pay, and then checks are collected and turned back in. We also have Friendly Visitor. We have 25 volunteers right now visiting with 25 clients on a weekly basis. Care Plus, where we are working on a sliding scale fee with folks who do not qualify for perhaps the options or the waiver programs, but they still need assistance. And we successfully piloted what we called Be Nourished. It's a medically tailored meal program. We will be expanding that. We tested the program with St. Joe's Medical Center. We had private foundation funding to take care of it. And folks with a chronic heart or a diabetic diagnosis at discharge from the hospital were, we tested them for 180 days, I'm sorry, and we were able to demonstrate a reduction in A1C, a reduction in weight, an improvement in blood pressure, and in overall feelings of generalized, health, self-reported generalized health. So we are hoping in the next quarter or first quarter of next year to be able to offer this to Reading Hospital patients, St. Joe's Medical Center patients, and provide folks with a series of medically tailored meals to improve their health. And that's the end of my presentation, and I'm a Michael Scott freak. I love The Office. So are there any questions? But there will be no questions, but I am happy
Nope,
to
nope,
answer.
I've got a bunch.
Okay.
It's just amazing the services that you're offering.
Yeah, and a lot of them just aren't known about.
Yeah, how do people find out about them? What's your most effective means of communicating with your potential clients?
It's Berks Encore News and it's BCTV. I'm telling you, and word of mouth.
Uh-huh.
That show on BCTV, Heather, I'm amazed at how many folks call and say, I saw that show. And it's like, wow, okay, people are watching. And then Berks Encore News, our newsletter, because it's still our folks are still predominantly newspaper readers.
Mhm.
We know the shift is coming, but word of mouth is also huge. I can say during United Way season, any company that will allow me to come out and talk to them about the United Way campaign and our relationship with Berks Encore, or yeah, I am Berks Encore, our relationship with them, it helps. It's just constant hitting the streets.
How do you go about finding the volunteers that you get? Jamie was really impressed by the friendly visitor program, and that dependence on volunteers seems to be a big part of your
It's
work.
huge. I have a total of 35 staff. That's full and part-time. That's everybody.
Mhm.
So
All the
everything, for the
six
most
centers
part,
and whatever.
at
Yeah.
all 6 centers, yes. Excuse me. Everything we do, it's highly dependent on volunteers. I mean, for example, when the weather's bad and the school buses don't go out, we figure volunteers aren't going to be able to get out. So we have to stop Meals on Wheels that day because with about 65 routes, I don't have enough staff and time to be able to deliver. So how we recruit, we advertise, we beg, we plead, we have a social media presence. We have a constant contact list. A lot of times there will be on BCTV just a feature about our need for volunteers. Beg, borrow, or steal, however we can get them. And then a lot of times too, that's word of mouth because our volunteers a lot of times are our very best ambassadors, and they go out and help us recruit their, friends and relatives. And it was, I have to say this, during COVID, when everybody else was kind of shutting down and losing, we lost 200 volunteers, but during COVID, we gained another 400 because people wanted to be able to help. And we never stopped. We shut down one day during COVID. That's it. We had an exposure in the building
Wow.
at the very beginning before anybody knew how horrible, just what it was. So I shut down, had the building totally disinfected. And that was a Friday. By Monday, we were back up and running again.
Is that the only impact COVID had on your work?
We saw an increase in our work. I
Uh-huh.
mean, we saw an increase in volunteerism. We never had to furlough any staff. We just all reshifted our duties. I had a donor call me one day and say, if I gave you $10,000, what would you do with it? And I said, I'm going to call Helping Harvest and I'm going to ask them, what the actual cost is to provide emergency food boxes. We'll pack them, we'll deliver them, but I will buy them from Helping Harvest at their direct real cost. I
Right.
called they so I get this check for 10,000. I called Jay. I said to Jay, what does it cost? He said 39 cents a pound. I said, shenanigans. What does it really cost you? I don't want to know the price for nonprofits. I want to know what it really costs you. At that time, it was $5 a box. And I'm like, done. I said, I want 200 boxes at $5 a box. All you have to do is show me how to pack them. The Santander Arena made themselves available. And I'm sorry, not 200, 2,000. 2,000 emergency food
Wow.
boxes were packed and delivered. And then that donor came back and gave me more money. And we then went to Redner's Markets and purchased 10,000 meals. So we had refrigerator, freezer, ready meals, all packed here at the Reading Center. Redner's chef was here. Gary O'Brien was here. They were all here. They parked a refrigerated truck outside my center, and we just kept loading it up with all this food, and 10,000 emergency meals ready to heat were delivered to our homebound folks.
Wow.
It was incredible the way the community pulled together around us. So we
That's
did
such a,
more work,
yeah,
and it was all good.
yeah, that's such a statement about the community.
Absolutely.
What,
Absolutely.
what do you think are the biggest obstacles for aging Berks County residents in terms of getting information, getting services, getting involved in activities?
Understanding that sometimes it is okay to ask for help. We
Mhm.
keep telling folks all the time, sometimes in order to stay independent, you need to ask for help. And what we also find is a lot of times it's not the message, it's the messenger. I don't know what anybody on this screen, what your parents were like, but my mom would not listen to me. I was the kid, and what did I know? But when I'd bring her in here and she'd talk to an expert, she would listen. So
Mhm.
we tell folks a lot of times, you may see things going on with your parents or your grandparents or whatever, and they don't want to hear it. But I send a social worker in who says almost the exact same thing, and all of a sudden they will listen. So I think sometimes we just get in our own ways because we don't want to admit, and it was somebody in Senator Fetterman's office said this to me when I was down in Washington. She said, when people look at children and youth and the programs and services that are provided to children, she said, we can all look back and remember how we were bullied, or that great camp we went to, or that school teacher that changed our life. She said, we all have something from our childhood that we can relate to, but none of us think we're going to ever relate to that 86-year-old person who is now living homebound, isolated, and alone. I'm 66 years old. I think when I'm 86 in my head, I'm going to be just like I am now. So it's not something I can really relate to. So it's getting over that hurdle. Sorry, I give long answers.
No,
Sorry.
no, that's okay. Luann, talk about a little bit about how you got into this type of work. Where did you start? How did you you didn't start your career working with the
No.
elderly?
As I've aged, so has my target population. I have worked in nonprofit my entire life. I always knew I was meant to do something that had a mission to it. I didn't know what that was going to be. I started out, I ran a nursery school, a kindergarten, a daycare center. Then I kind of got tired of that. And then I moved over to at-risk youth and started working with keeping kids off of alcohol, tobacco, and other drugs. And then I hit the magic age of 50-ish, and I was like, probably late 40s. And I was like, this job became available and it looked interesting. It looked fascinating. It was an agency in trouble. They were losing about $250,000 a year when I came to this agency about 18 years ago. And I thought, okay, one more challenge. Let's take it on and see what we can do. And it turns out I love working with the aging.
I'm going to come back to that in a second, but
Mhm.
talk a little bit about what's the biggest challenge that Encore is facing right now?
I think like any nonprofit, it's funding. It's, if you saw, there's still about just for the home delivered meal program, we still have to raise about 30% of the money it costs us just to provide the kind of care that we want to be able and we feel obligated to provide. So funding is a challenge, and getting the message out about, we were talking about before, it sometimes being independent means asking for help and getting people to understand we're not there to take away their autonomy. I don't want to put in, I have no authority to put anybody in a skilled nursing facility. We just want to help them stay safe and independent in their home for as long as possible. And that's sometimes hard to get people to accept. I'm not
How do
taking
you
away anybody's housing or their independence. I'm sorry.
now talk a little bit more about that? How do you work or get people to accept it, especially as you were saying, with your own mother? Obviously, she wouldn't listen. My mother wouldn't listen to me.
My mom, yeah, she was a pip. Um, okay, say that question again, because I just went down the rabbit hole of my mother. I'm sorry.
That's okay. We'll bring you back up. How do you effectively communicate with the seniors? What's the best strategy to do this? What advice would you give us on this to help with this?
To let them know, and if you've got an aging parent, to just, how about we go in and talk to them about, let's just go in and have your Medicare looked at. Start with something easy. Mom, or dad, have you looked at your Medicare lately? Are you sure you're on the right program? Yeah, you trust your agent, but why don't we just get somebody, who is out there unbiased and unaffiliated just to take a look. And it's more as they come in and see us and talk with us and see that we have no authority. We can't make them do anything. And usually we find that we try to be, so our mottos are gracious hospitality and service with excellence. So whoever you are, when you walk in your doors, you should be, and you have the right to be, to greet it with a smile, asked how we can help you, if there's anything else we can do. And it's just that friendliness and that engagement. And sometimes just when they come in and they realize it's not a threatening place to be, and it's not a lot of people, it's not adult daycare. It's not. We are a non-touch agency. Everyone who comes to us has to be independent with their activities of daily living. So toileting is independent. People are feeding themselves. It's not a skilled facility. And I think people just don't understand the difference between a senior
Hmm.
center. So we're forever working on,
Hmm.
just come in and take a look. You'll see. And we can have fun, and there's music playing, and somebody might be dancing, and yep, they're all breaking a sweat over here doing yoga or whatever. It's an active community.
One of the things you mentioned early on was talking about online access. You talked a little bit about healthcare stuff. How do you deal with that? And seniors, I'm guessing, are a little bit more less tech savvy than 18-year-olds.
Our that's starting to shift and change. You'd be surprised when you come in a senior center how many have their smart devices with them. Um, that's more of our homebound population. So what I do, if I'm sending somebody in to the home, a social worker or whatever, and we send them in with a hotspot and the whole bit so that they can access things online. We don't expect our homebound to be quite as tech savvy currently as I believe they will be in the next 5 to 10 years.
Hmm.
But seeing folks with smartphones, it's becoming much more common. Flip phones, not so much anymore, but smartphones and iPads especially. So it's taking a shift. We're working very closely with the digital literacy um, initiative in the community. We have 10 new laptops coming in, and we will be teaching digital literacy to those who need the help, offering the classes here and letting the digital literacy collaborative take care of the work for us, because they're doing it. So we'll let them come in and do it and just
Good.
offer them the spot.
That was going to be a follow-up question. I'm going to open this up. If anybody has any questions they want to ask, I'm going to start calling on people that people don't mind about that. And particularly about the last topic we just talked about. Ryan, do you want to talk a little bit about what the Literacy Council is doing in terms of digital literacy?
Hey, Ryan, I didn't see you there.
Yeah. Hi, Luann. Hi, everybody. Yeah, the Literacy Council is also actively involved with the Digital Equity Coalition. And at the Literacy Council this year, we just migrated to an online registration system for our students. So the students can complete the intake form to participate in our programs and complete the form in their own language so that they understand the questions that are being asked of them, which are required by our funders, namely the Department of Ed and also the United Way of Berks County. And what precipitated this was earlier in the year, I attended a national conference on adult literacy in Atlanta, Georgia. And kind of what Luann just mentioned, we are starting to see the shift in adult education where our clients are not at the point where they're no longer scared of the technology.
Mhm.
They have the technology, whether it's a smartphone or an iPad, they just may not know how to use it properly. 5 years ago, we were faced with people who didn't know how to turn a computer on. They didn't know what
Yes.
a mouse was. They didn't know what a keyboard was. So I think that the pandemic sort of moved that forward. And so everything here is becoming digital. We're even starting to do some assessments online, and on a platform like this, we can do language assessments on Zoom. I would have never thought of that 3 years ago. So the Digital Equity Coalition, the work that the coalition is doing to help us get Wi-Fi and better connections throughout the community, I think is going to go a long way to help the nonprofits with their work here in the community as well, because our clients are, faced with needing to get better access to technology, not technology necessarily, but being on the having better internet connection and so forth, because everything that we're doing here and that I know my colleagues are doing in the other nonprofits, the people need people are using technology. But that's a long way around to your question. Did I answer your question, Dave?
That was fine. That was fine. I know you've been doing a lot of work in this territory, and so I thought it would be good to share that information and understand what Luann's doing. Heather, you had a couple questions. I don't know if you want to go ahead and ask.
So I'm just really interested. I know that a couple of years ago, hearing a figure about how large the aging population is in the county, how much demand and increase in your services are you projecting for, and is the demand on services increasing steadily? Oh, Luann, you're muted.
You're muted.
Sorry about that. Yeah, we're seeing on an average about 23% a year. We see the increase, especially in our demand for the home delivered meal program. And we've been very fortunate in that we have not yet had to go to a waiting list. Everybody who needs gets served. So, Berks County is following the aging trend, just like you're seeing anywhere else in the United States. So, yeah, I anticipate this is going to continue probably for a bit past my retirement.
So 23% a year, that's phenomenal.
Mm-hmm. We have a difficult time sometimes keeping up because we need to assess everybody every year. We need to see them every 6 months. Then you have all the new assessments coming in, and then we're also every 3 and 9 months making phone calls to the folks. So we're always looking for interns. We have 2 medical students working with us, but the demand is high. And I sit on the Meals on Wheels America board, and we're right on trend with the rest of the nation.
So we're not behind or ahead.
No, we're right on trend.
Yeah. Anybody have any other questions here? No, everybody's okay. Cindy Millen, you want to talk a little bit about how this fits into the framework of the Berks Community Foundation? Hopefully you're there.
I'm here. Hello, everyone. No, I mean, we are a funding source for potentially for programs like this. One of the programs or funding sources we have is the Home Health Care Foundation Fund that will reopen in January. And it's really looking for programming that prevents inpatient hospital care. So programs like the healthy, meals delivered specifically for people with the diabetes or the heart issues. Those are things that hopefully prevent inpatient care. Those are the kinds of programs that we're looking for. So if anyone has any questions about that, feel free to contact me. Again, it's the Home Health Care Foundation Fund.
Cindy, I failed to mention that the Community Foundation was a part of funding our pilot and through that fund. And we're very, very grateful for that because we really did get some great results from it. So we hope to be able to continue it. So thank you. Thank you.
Welcome.
Anybody else have anything they want to say? Otherwise, I will let everybody head out here. But Luann, I think very impressive the work you're doing and how it has expanded and grown and the breadth of it. But
thank you.
What's amazing to me is how engaged you've gotten the community and helping support the work you've done. I mean, that's not easy. And
it's a great staff, a great board, opportunities like this, people listening, and then before you know it, somebody will say something and thank you, Heather. I just saw that. Thank you.
Say it out loud, Heather.
Oh, it's just thanks, Luann. When my grandmother was living, we turned to Berks Encore for some assistance with medical evaluations and some care, interviews and things like that. And everybody was so great to work with. And I don't know how you serve the sheer number of people you do with the attention to detail, but it's appreciated. You're doing great work.
Thank you so much. I appreciate that. Thank you.
Any final comments, Luann, that you want to make before we shut this down?
If you haven't volunteered and you'd like to, give me a call. I personally will go out on a route with you and just show you how cool delivering meals can be. I can tell you the first time I delivered meals, my first week on the job, I came back in tears because one, I was surprised at how grateful people were to see me who had never seen me before in my life, and how friendly they were and just how happy I for a meal, and then it was complicated for me by seeing the situations that some of them live in. And I was just I was a mess for a while, but I've never regretted a day here. So if you want the experience, happy to give it to you. I'm sorry.
No, I would think the services you guys are providing are phenomenal and really significant. But you had mentioned the need for socialization. And I think that's something that happens. I know it happened with my own mother. I was busy raising kids, and so I wasn't paying as much attention to her. That need social interaction, social contact is so important. And maybe just close with that a little bit.
Well, the Surgeon General not that long ago had released a report about social isolation impacts health similar to, if not worse than, smoking, because it leads to depression, chronic disease. It's debilitating the more alone you are. And if you have those older relatives, I know we can be a pain sometimes. My grandson will roll his eyes at me or something because, he calls me and he makes my day. But it's just paying attention to them. If you see somebody at work, I now go to the grocery store checkout lines where I see the oldest person working so that I can go and have a little bit of an interaction with them. You really can change somebody's day. And when you're behind them in the car, I mean, these are just silly things I've done I don't get so angry anymore. Like I said, seek them out at the grocery store and sometimes just standing in line, just engaging them in a conversation because you just don't know sometimes. You are the only person that may give them the time of day, because the one thing I don't think I think American society has some lessons to learn is how we treat our elders. And I can tell you, working here made me a better daughter to my mother, and it's a lesson I've just tried to carry on with others that I encounter that are stooped of stature and
Yeah,
slower to move than I am.
yeah.
So anyway,
Thank you. Thank you. Thank you for your work. Thank you for the difference it's making in this community. It's, as Heather's mentioned, it's so important, so significant. And it's game changing for lots of people in ways that most of us don't probably understand or appreciate.
I've got a great team. It's not me. I've got a great team that I work with. So thank you, everybody. Thanks for your time. I appreciate it. Thanks for listening to me ramble on.
Oh, you were terrific. Thank you, everybody, for joining us. We will be sending out a copy of this video to everybody who registered. Just really exciting stuff to see. So what an impact you're making on this community. Thank you.
Okay. Bye-bye.